And then this is what coming up?
This is
Ascending aorta. This is the superior vena cava coming down. This is the inferior vena cava coming up, right? And then in the back, this is the coronary sinus. These three go into the right atrium, right? That's your right atrium right here. What are these here?
It has to be the left atrium.
These are the pulmonary veins coming into the left atrium. Right? Separating the atrium from the ventricle is this sulcus, the coronary sulcus here, right? So you have this coronary sulcus separates the top and the bottom, and then separating the left and the right is the interventricular septum. It's not very clear on this model. So now you have the anterior, this is the right cardiac artery, right? This is the left cardiac artery, forming the anterior interventricular artery, and the circumflex artery going around the back. Okay? Great cardiac vein, right? Right cardiac vein, I believe this is, coming up, right? And coronary sinus in the back. Okay, so now, on each atrium, you have auricles that kind of come off like the dog ears, auricles. Then let's open up the right atrium. Looks like somebody taped this together. Open up the right. Let's do it this way. All right, let's just open it up this way then. So we're taking this open, and you can see this is the right ventricle, right? And you can tell it's the right ventricle, number one, because the blood flow comes back up through this pulmonary trunk. And this is the pulmonary semilunar valve, prevents backflow. These are the chordae tendineae. This is the papillary muscle right here. This represents the trabecular carne, how it's kind of like trabecular-like, trabecular carne. And then this is the left ventricle over here. Let's open that one up. This is the left ventricle here. Notice the wall is thicker compared to the wall here. Yeah. See how thin the wall is there? This is a thick wall. Trabecular carne. Papillary muscles connecting to the chordae tendineae. Now this valve on the right is the tricuspid. It actually has three flaps. This valve on the left is the bicuspid, only has two flaps, otherwise known as the mitral valve. And these valves are connecting the atrium to the ventricles, right? So when the atrium contracts, it goes down through these valves. When the ventricles contract, those valves snap shut. The chordae tendineae help to guide wire the parachute so it snaps up nicely. If you have backflow from a chordae tendineae up into the atrium, it would cause regurgitation into the heart, and it's very common to have mitral valve regurgitation. People get that. And then that could cause a really serious problem, could cause mitral valve prolapse, where the actual valve prolapses up, and that may need to be corrected with a valve correction, or surgery, replacing that. So you have your right atrium. If you open up the right atrium, I hope I could do it. It's not letting me, but I'll do it. The right atrium, you can see the tricuspid valve, three flaps. The pectinate muscles, that's the pectinate. Whereas in the ventricles it was called what? Trabecular carne. You see the fossa ovale right here, the remnant of the foramen ovale from birth. And then you see the superior vena cava coming down, inferior vena cava coming down, and you can't really see an opening here. Well, maybe this is it. I'm not sure. Either this is the fossa ovale or this is the opening of the coronary sinus, either or. I think that's the fossa ovale here, and this is the opening of the coronary sinus coming in. So the white would probably be the fossa ovale. Okay, so now you have in the left ventricle coming up through the semilunar valves, the aortic semilunar valves going up through the aorta. It doesn't show very well on this model. Maybe on this model it'll show it better. Probably does. Here's the left ventricle. Aortic semilunar valve is going to go up through the aorta this way. It didn't show it that well. Let's look at this other model over here. Can I get that? Can I just get that model there?